feces, so it reached the soil. And in the soil, it gives rise to rhabidity-form larva. Of course, like under the ideal condition of moist soil or warm weather is there, right? So they keep on feeding, taking their feed from the organic material in the soil, and after about 7 days, the larva stop feeding and they change and they develop into the third stage, infective flariform larva. So basically, they are present on the grass, and whenever they come in contact with the human skin, okay, they can enter the human. So this larva outside the human body can survive up to approximately 2 weeks, and that's the reason. So guys, quite easy. Enter the skin again, like circulation, right heart, lungs, GIT, start producing eggs. Remember, this one consume hemoglobin. It have hemoglobinases. So this is about the life cycle and what is the clinical manifestations or the clinical features of this condition. Now, if we'll talk about the clinical features of this one, the clinical features can be separated into acute features or acute manifestations. Okay. Of course, like acute manifestation means what? Like, it will enter the skin, it will reach the lungs, it will reach the GIT, that's it. Like, which is the same story as the previous one. Nothing different, okay? So, simply. And also chronic manifestations. Now, chronic manifestation, they result from the parasite in the intestine and they keep on consuming the hemoglobin. So again, guys, like as in the previous lecture of strongyloids, I told you the important thing, right? How they have cutaneous manifestations, pulmonary manifestations, and GIT manifestations. So you can say they have almost the same manifestations without any much difference. Okay, so like if you want to understand like what I'm saying, you can see my previous lecture in detail. So of course, like you can say what you can say, like anyone whenever they get infected by this larva, this one, they have skin manifestation. We call it as ground itch. And what is ground itch? It's itching, a local pruritic erythematous and papular rash. Okay, and it's commonly present on the hand or feet. So this thing will be there, right? Now, what happens is like whenever this thing occurs, of course, like if the area is highly endemic or there is too much infections, you can think of this thing. But many of the times, like we can see some skin changes as well, like as the larva is migrating under the skin. Okay, as the larva is migrating under the skin, so we can see the tract of that larva. We call it as creeping eruption. We call it as creeping eruption. So creeping eruption, like maybe I can show you here on Bing and creeping eruption. You can see, it looks like this. See, because the larva is moving under the skin. You can see over here or over here, right? Like the larva is moving under the skin in the subcutaneous region. So we call it as creeping eruption. See, a lot of larvae, right? We call it as what? Creeping eruption. So this creeping eruption can be seen, right? So these tracks or these eruptions, they can be elongated every day, and sometimes it can be there for years. Okay, but when as soon as the larva will like leave that area, like these eruptions will be healed. You can say within some weeks. So you can say like after around 1 to 2 weeks of this skin infection, uh, you can say there will be lungs manifestation. Okay, you can say like this way that after around um, um, 1 to 2 weeks, the um, larva reaches larva reaches the lungs, right? So the larva reaches the lungs, and again, like in this one, if you remember the lung manifestation, you can talk about that, right? Like simply, cough will be there, wheezing will be there, wheezing can be there, cough, dry cough, or these things can be there, right? So now, um, of course, like when the larva is ascending through the trachea, and then it will reach to the pharynx, and then it will be digested by the or taken up by the GIT. So this thing is important. So now, when we ingest that, there could be acute symptomatic disease after ingestion. So what is this thing? Like the patient, they present with nausea, vomiting, hoarseness, and dyspnea. In some of the countries, it is called as Wakana syndrome. Okay, not important to remember, but like in some of the areas, this is called as Wakana syndrome. So simply like what it is ingested, if it will be reached the GIT or the intestines, in simple words, then the manifestation will be changed. Then it will be like nausea, vomiting, abdominal pains, bloating, all this stuff. Okay. So now, like they will keep on laying down the eggs, okay, and uh, the patient will have like either these symptoms which can go unnoticed simply. Sometime some of the patient, they have like acute enteritis with uncontrollable diarrhea and foul stools or very bad smelling stools. But like there can be no symptoms as well, right? Now the person will reach or go into the chronic status or chronic infection. Now the chronic disease is simply, guys, it is due to anemia. Okay, they keep on um, consuming your hemoglobin. Okay, and they stay in the small intestine and they keep on consuming the hemoglobin. Okay, and what will happen, like once they will keep on consuming the hemoglobin, it is estimated like around 0.1 ml of the blood is lost every day. Okay, which is like too much, sometimes up to zero point 0.3, by the way. So what will happen chronically is basically they have anemia. What kind of anemia? Simply iron deficiency anemia, right? They present with iron deficiency anemia. So this will be the one of the manifestation. Now, what will happen, because it's not like the anemia which will be there, but of course, like a lot of proteins will be wasted as well. So people who have heavy hookworm infection, they may go into hypoproteinemia. Okay, and these are the two things, by the way, which basically cause too much burden on the children or developing children and the maternal pregnant females. And this is what you can say the main things by which, most of the babies, they are physically and intellectually not developing normal, okay, in many of the countries. So that's why they are worried of this thing. Now, guys, if you know what are the features of anemia as well as what are the features of hyperproteinemia, I think like the rest of the story is clear. For example, anemia features are dizziness, weakness, pallor, tachycardia, fainting, dyspnea, palpitations, things like this, right? And what you can say, and hyperproteinemia, of course, they may have develop edema, for example. Okay, so these are the things, which can be there. And of course, like not just these things, of course, like these patients, they may have diarrhea and constipation as well. But these are the chronic manifestation of this condition. Okay, so this is how this thing present, right? Now, so okay, this one is too creeping eruption is too you can say specific for this condition, right? And the diagnosis can be made at this stage, or the thing you will start thinking about this stage. Okay, so how we diagnose this condition now? Diagnosis. So now the diagnosis, again, the first of the things will be, stool microscopy, which is of course like from that CDC chart you can see, like, we can see the eggs in the stools. So what happened, like in the infected adults or in the affected humans, a single female, it produced thousands and thousands of eggs. So that's why, when they produce thousands of eggs, it can be easily found. Contrary to the previous lecture in which like they produce less eggs, they produce good amount of eggs. So as I told you, the eggs are colorless, and they are quite small, but they are colorless, and there are special techniques by which they can see the eggs. For example, they can use formalin, ethyl acetate sedimentation method, and some things are called as concentration procedures, in which like they can dry up the mount, and then they can use some stainings, okay, to see the eggs like under the microscope. So this thing can be done. So uh, now, other than microscopy of the stools, CBC can be done, in which like there will be eosinophilia, and it is a common finding. We can see. Now, chest X-ray can be done, of course, to check for the lungs when the pulmonary phase is there, or sputum examination can be done if like it is the time when it is migrating. You can get this thing, right. You can get the test positive. These things, and there are, what you can say, um, other diagnostic methods are also there, like other than microscopy or stool culture. Um, so see, like the diagnosis can be clinical based on the this cutaneous eruption. We also call it as cutaneous larva migrans. So, like the larva is migrating, simply remember from this thing. So there could be like the skin grounders, there could be like this cutaneous, sorry, there could be this one, or there could be like lung manifestation. And whenever it comes to the diagnostics, we can go for stool microscopy, okay. uh, we can do for CBC, we can go for chest X-ray, we can go for sputum examination. And CBC will show what? CBC will show high level of eosinophils as well as microcytic hypochromic anemia. So these things can be done, right? So stool culture is one of them as well. Sorry, I wanted to write over here. Stool culture can be done as well. So these are the way of diagnostics of this condition and how we treat it. Treatment. Now again, the treatment goal is to eliminate the worm completely from the GID. That's an important thing. Okay. And the most common drugs which are used again is benzimidazole group. For example, mebendazole, mebendazole, albendazole. Okay, all these drugs can be given. So, like these both are, by the way, broad spectrum antihelminthic agents, and a single dose of mebendazole or, albendazole, single dose or multiple doses, both are enough, by the way. So this is what you can say is the treatment of this condition, and simply we give them um, any stage, like even if you will found the patient, at any stage, you can give these drugs. And one of the drugs which I'll talk about in the previous lecture as well, ivermectin. So when you will study pharmacology, you will study about ivermectin as well. We can use that as well. So this thing, and the other treatment is of course treatment of chronic stages, of course, like treat anemia and treat malnourishment. Okay, and of course, like how we treat anemia, how we treat malnourishment, that's a different discussion completely. So the last thing, guys, which we are going to discuss in this one is the prevention. Okay, prevention, like as we always discuss. So again, like the first thing I will say, like improve sanitation. Okay, that is the most important thing. Okay, in this one, proper, you can say, personal protective equipment for people at high risk. Like footwear should be there, gloves should be there. Okay, all these things should be there. So of course, like this one, because many of the people who work like in agriculture field, it's very hard for them. So of course, like they must use proper PPE or personal protective equipment, because this one they can penetrate the skin. So of course, that's an important thing. And many of the people, they use the feces as a fertilizer as well. So this thing, one thing is like treat the infections, give them drugs, of course. In many of the countries, they used to give albendazole or mebendazole to the school children, and just to decrease or. By the way, one of the thing, in our country, whenever the patients or the babies they come to the pediatrics with anemia, so they are usually given albendazole just to deworm them. Okay, so that's the important thing. So because like they cause like serious problems in the children, especially because their growth is affected, their development is affected when they have this infection. Now you can say other things which we can do is other than this is like of course like awareness of the condition. You can say awareness can be spread in the areas where this is endemic. Of course, like the people should be educated what to do if they found this features, the signs and symptoms. They must go to the doctor. One of the thing like education is very important in this case. For example, not just the people but also the healthcare workers to deworm whenever like anyone is presented with anemia, for example. So deworm them. Of course, that is going to help a lot. So that's all about, guys, about this Ankylostoma duodenale and Nectar americanus, which are both hookworms and they cause such a condition. Thank you so much.